Good afternoon, everyone. I'm Governor John Carney, and I'm here once again for our bi-weekly press conference on the state of Delaware's response to the COVID-19 pandemic. I'm joined once again by the two leads of really hardworking teams on the emergency management side, A.J. Shaw, who's the director of the Delaware Emergency Management Agency, and Dr. Carol Rattay, who's the director of the Division of Public Health in the Department of Health and Social Services. This is the second press conference this week, and our focus today will in large part be on the considerations underway and the guidance that we're making available for the gradual reopening of state government targeted for June the 1st, with interim steps that we've been taking on a regular basis since we started gradually reopen various sectors, and since the shutdown, where we considered some changes or exceptions to businesses that were able to work or keep some business going in a way that was safe for the public and for their employees, enabling them to get some revenue. And that's really been the focus all along, is to try to make some accommodations so that we were protecting the public health while responding to the imperative of a strong and working economy. And that's a balance that we've tried to strike from the beginning. Thinking back now, we've been in this since the first positive case in Delaware about 10 weeks ago, and for the first several weeks I remember all the calls that I was getting and the pressure that I was getting. What I was hearing from the public was that we were moving too slow in shutting sectors of the economy down and protecting the public, but with stay-at-home orders. We'll give you a list of those actions that were part of the state of emergency declaration over the last 10 weeks. And then for the last several weeks now, more and more I'm hearing that we're not moving fast enough, or that we're moving too slow again in reopening the economy. In both cases, we are trying to balance out the needs of workers and businesses with the protection of public health, the protection of public health being very essential to the strength of the economy. And so what's happened as a result of your efforts, Delawareans' efforts, and the actions that we have taken to reduce the spread, minimize the spread in our state, to use data and public health guidance from the Centers for Disease Control, the White House Task Force, our own public health officials, we've been accomplishing over the last several weeks what's referred to as flattening the curve, which essentially means reducing the spread of the virus in our state. But I guess we have mixed messages a little bit today as we talk more about reopening. Now is not the time to let down. Now is not the time to just continue to just go right back to the activities in a way that we conducted business prior to the COVID-19 pandemic. Now is the time to be careful, to continue to stay at home when possible, to practice appropriate personal hygiene, and to continue to lean into the efforts to protect yourselves and the broader community, and to be thoughtful of others around you as your neighbor, and recognize that the things that you do affect your neighbor and his or her health, particularly if that neighbor is a senior citizen, and to continue really to lean into that objective of protecting senior citizens. And so while we are going to start gradually reopening sectors of our economy, and we'll show some guidance today about how that's going to happen, my message to every Delawarean is to continue to be vigilant, to protect our senior citizens, and to observe social distancing and mask wearing to protect yourselves and others. I've had a lot of questions over the last week in particular, from people who think we're moving too fast in reopening, and frankly from people who think we're moving too slow in reopening, about what criteria we are actually using. I'll talk in a minute, I'll show in a minute the dashboard of indicators, but one of the things that I've been saying for several weeks now is that because of the lack of really extensive testing in our state, because of the inability to get the test equipment that we need, and because of the testing that's been done mostly by the hospitals, and they've been great partners. I need to give a shout out once again to our hospitals, and particularly the downstate hospitals over the last couple of weeks. I got a call this morning from a friend who lives in Lower Delaware who couldn't say enough positive about the community testing site that Bay Health conducted there in Milford, I think a week or so ago, and just was so impressed with the way it came out. Yesterday, we had a dry run with our new saliva specimen testing procedure in Seaford, and was very well done, and we tested over 600 people in a couple of hours, which is as fast as we could go. But because of the unevenness both of the testing and, more importantly, the way the results come back, the hospitals over the last 10 weeks have been reporting that they can get test results as soon as maybe 3 or 4 days, but as long as 10 days to 2 weeks. And so the tests come in an uneven basis. And recently we've tested nearly 10,000 people in Sussex County, and the processing of those tests have affected the way we've incorporated them into our data, and I'll talk a little bit about that. And so from the beginning, we knew that we had to pick a dashboard of criteria that included hospitalization rates, that included day-to-day positive case rates, that included 5-day moving averages of those, as well as now recently the percent positive on the new positive cases, because we're doing so much more testing, and the day-to-day hospitalization rates. And so one of the things, the criteria that I lean on the most and look at the most is that hospitalization rate. Because if you think of the overall objectives of the shutdown and of preventing the spread, it's mostly to protect your hospital critical care capacity, your ICU units, your critical care units, your ventilators. And we've been well below that capacity throughout the last 10 weeks, and increasingly that day-to-day number is going down, and the total number is well under 300 again, even at a time when the number of positive cases there in Sussex County and across the state for that matter are rising. The percent positive of tests have been going down from somewhere in the 30% positive to, over the last several days or last week, anywhere from, AJ, 10 to 15% positive. And so we did have a glitch, as I mentioned in our press conference earlier in this week, in that percent positive, and it really had to do with the way data is entered into the system, and a competing objective that we have to get positive cases loaded up into the system so that that information can be forwarded over to contact tracers so we can help prevent the spread through that, and Dr. Rattay will talk a little bit about that. We believe we have that glitch fixed, and some of it was just a matter of doing some day-to-day hand-to-hand math and determining that percent positive was, as we thought, continuing to trend down. Again, I think if you look at the charts, and we'll get to them in a minute, that hospitalization rate is the one that we're most confident with, because it shows both the actual number of people who are in the hospital with COVID-19 symptoms, their a degree of seriousness, which has been assessed by hospital personnel, and those capacities that we're attempting to protect as one of our major objectives. And so we will use that dashboard of criteria to gradually reopening, and we've taken some interim steps with respect to retail and other business sectors, the nonprofit sector, and we'll talk about the guidance that's being distributed today for phase one. One of the things that I've heard about a lot from the people of our state is the need for churches to be reopened. And I think one of the things that we need to make clear is that we never, as an essential function, as a constitutional right, we never did close churches and places of worship. In the first place, we just limited public gatherings to 10 or fewer, which effectively, for many of those places of worship, meant that there wasn't a way for them to stay open. Well, there's been a lot of discussion back and forth. I've called a number of the religious leaders in our state over the last several days. We've been working with a set of guidances for churches and places of worship as they welcome back, if you will, their congregants to their places of worship. I did consult with my council on faith-based partnerships, which represents many denominations, Christian, Muslim, Jewish, and others, and they have provided input to this decision-making. My mother, who's 89 years old, wants to go back to church as well. She goes to a Mass at St. Anne's Catholic Church pretty much every morning and is missing it. She's been doing her Sunday obligation remotely through television broadcasts of Masses that she's able to attend, but I know she's eager to get back to church, as are thousands of Delawareans, and I am certainly sympathetic to that. I'd like to get back to my church on St. Joe's on French Street as well, but want to do it in a way that's safe for the whole congregation, and most importantly for this senior congregants that we have in our churches. And in my church there are many, if not most, fit into that category. And so we will on Monday have a guidance to allow more people to come back to our places of worship, and I appreciate all the input that we received from religious leaders across our state. And so with those kind of opening comments and reflections, I'd like to turn to the deck and just go over the number of cases. First, you can see that the number of positive cases continues to rise in Delaware. We're up sadly to 271 total deaths. Recoveries also rise, and then that number that I look at very closely and that we use to make a lot of these reopening decisions, the current hospitalizations is down to 269. It had peaked over 300, and again, even at 300 or better, is well below the capacity that we need to serve any glitch that we might have. So how did those cases, how are they distributed across the counties? We've got 2,600 positive cases in Newcastle County. We have over 1,000 at 1,146 cases in Kent County, and then with the increased testing that we've been doing in Sussex County, particularly in communities where a lot of the poultry workers live, 3,500. We've had community testing in Milford, in Georgetown, in Seaford, and other communities across Sussex County. By early next week, we will have tested thousands of poultry plant workers as they went into work. And one of the things that the Secretary of Agriculture has told me is that the testing that we're doing in those plants, one of the biggest concerns that I know the plant operators had and that we had, that were two things. One, that they would have too many workers who tested positive to enable them to run the plants, and secondly, that folks wouldn't show up for work. Well, what we've seen is the increased testing, and the fact that those who test positive are sent home and asked to self-isolate. More workers who may not have been sick but may not have been going to work have decided to come back, and actually those numbers are up in terms of attendance at the plants, and that's a good thing both for the workers and for the plants, and we are identifying those who are testing positive and protecting them and their families and folks that they come in contact with. So that's been a major focus. Again, we need to thank the hospitals, Bay Health, Beebe, and Nanticoke for their help there. Christiana Care lended a hand as well, doing some community testing in Georgetown, and just really good all-hands-on-deck effort there in Sussex County, and Public Health, of course, with great guidance there, and on-the-ground community workers the same. So the next is the cases by demographic ages. You can see there that it's a consistent pattern, very few cases among young children and teenagers, most of the cases in the broad middle age category, and then there's the population that we try to protect because of their vulnerability, our senior citizens. And so earlier on I talked about and get a lot of questions from people who think we're moving too fast with reopening, and people who think we're moving too slow with reopening, mostly because we receive guidance from the CDC to look at improving conditions over 14-day periods of time. And so you look at our dashboard. The first dashboard is a series of these criteria, starting with hospitalizations, and you can see the rate is a gradual downward trend. If you look more closely at this graph, you'll see the underlying hospitalizations in Sussex County, where we have the more intense testing and the much higher positive testing results. The hospitalization rates have actually been trending down, and that's a bit of a surprising thing, but a good thing as well. Again, the next slide shows new hospitalization admissions, and the last several bars there really show that the hospitalization rate is declining as the new hospitalizations by day continues to go down. The next graph was the one that in the last, on Tuesday, earlier in the week, we saw a little bit of a rise, which was a glitch in the data entry there. Dr. Rattay will talk more about that. I've mentioned it. It's really a function of the number of tests that are being done in the lower part of our state, and the really important objective of making sure that staff is entering into the system the positive cases, so contact tracers can reach out and contact those individuals, and the negative cases lagging behind. Obviously, all of those cases are ultimately put in the system, and you can see that it's leveled out and continues to be in the positive trend. This hospitalization percentage of persons testing positive was up in the close to 30% range, and now, as I said earlier, in the 12 to 15% range. And as AJ is taking over the point person there for our increased testing, this will be something we'll continue to look at as we move forward. So the next chart on the bottom is the cumulative number of positive cases over the last 14 days. We're looking at 14-day intervals, and I think you've got two charts that look the same to me. And then finally, the chart of cumulative positive cases there. The next set of dashboard, COVID-19 data dashboards, is the personal protective equipment status, and you can see we have a red, yellow, green code here for gloves and face shields, surgical masks, isolation masks, N95 masks, and all are in the green category, except the gowns. The hospitals have been having some challenges with gowns of late, and we'll keep our eye on that. I'm not going to go through the next set of slides, but this is our recovery plan for phase 1. You can see there on the first page there, we have general guidance that applies to all individuals and businesses, and it'll look familiar. It'll be talking about social distancing, 6 feet social distancing. It'll talk about hand sanitizing and washing your hands and wiping down the surfaces that are touched often. It will be avoiding large gatherings, which will still not be permitted. It will be the kinds of guidance that anticipates a phase where we're trying to keep people safe while allowing them to do more in the public. Already we're seeing through polling data that people are letting their guard down a little bit, and I would just say now and reemphasize that message that now is not the time to do that. It would be a shame, all the pain that we've experienced over the last 10 weeks, to lose ground by just getting a little bit sloppy, if you will, a little bit careless now. Now is really the time to lean in as we get into phase 1, as we adjust to a new normal in retail, restaurants, and beaches, and the rest. The second graph there, there's guidance for each industry individually, which was developed by our experts in the Division of Public Health, and a shout out needs to be made to Jamie Mack, who's just done an incredible job working with the team, Damian DeStefano in the Division of Small Business, Secretary Jeff Bullock, industry and business sector leaders, legislators, the local officials, as we've developed criteria for gradual opening of those businesses. And then there will be specific guidelines and guidance for businesses that may seek a case-by-case exception to these provisions. So we did take a lot of feedback through statewide Zoom town hall meetings that Lieutenant Governor Hall Long coordinated with the Division of Small Business, the Secretary of State, as I mentioned, and small business leaders in geographic representative districts, geographic districts in our state, Eastern Sussex, Western Sussex, Kent County, Southern Newcastle County, Northern Newcastle County. And we got lots of feedback online, and I listened in to some of those town hall meetings, and we tried to incorporate that feedback into the reopening. The next several slides just shows you the gradual reopening by sector. You see the first one there, food and drink establishment, arts and culture, retail malls, and on and on and on. I talked about places of worship, which continue to be open in a very limited basis at the 10% limit, but we will have new guidance on that that we'll release on Monday. And then the schools and other businesses that remain closed, which we will be looking at in phase 2 and beyond. And then lastly, before I turn it over to Director Shaw, just the list of executive orders that were part of the state of emergency and its amendments going back 10 weeks to March the 11th, and going forward to the rolling reopening that's underway, starting with the steps that enabled retail and salons to do business in a limited way last Friday, and then the reopening guidance that we are releasing today that will go in effect next week on next Friday on May the 22nd. AJ.
Thank you, sir. So Governor stole some of our good news, but I think it was a great day yesterday down in Seaford with our partners at Nanticoke Hospital, National Guard, Public Health, and really the law enforcement, EMS, and community partners that came out there. So within 4 hours, in some training of our staff in public health, over 600 people were tested with the new curative tests. This was about a 50-50 split of people that registered in advance. We only got the link out about the day before, and then some walk-up. So this will provide an email notification to those that provided an email address when they registered. When the test is completed, it will give instructions if it was positive, how to follow up, as well as public health will follow up with them as they get that information. And if it's negative, they'll get the negative as well. So we're looking about 36 hours afterwards for them to get that information. So that is great, and now it's full steam ahead. Next week, we'll continue. On Thursday, the 21st, we're going to continue at Middletown High School. We expect to go from about 10 to 2. If we could go back one slide. Yep, right here. So it'll be online registration available for the test that the state is facilitating. So Thursday will be Middletown High School. We'll go from 10 a.m. to 2 p.m. We're expecting to get about 2,000 people, or excuse me, about 1,000 people through Middletown and another 1,000 through Dover on Sunday. Both these links will be online later today or tomorrow morning at the latest to pre-register. More people that pre-register, more people we could get through. So it's highly encouraged that if you have the access to a computer or you could do it on your phone, you pre-register. It takes about 30 seconds. There's also a toggle switch up in the right-hand corner that lets you go between English and Spanish. So excited to have those two, really probably 1,000 people each between Thursday and Sunday. That will be done by our state partners. As well as what's going on next week, St. Francis Hospital, in conjunction with other partners from Wilmington, will be doing some testing at Judy Johnson Park on Tuesday the 19th. We have the Middletown High School on Thursday. Glasgow High School with Christiana, I believe, on Wednesday as well. And then we're going to be doing some almost door-to-door service, so with some of the Wilmington Housing Authority properties, dropping off test kits, walking people through how to fill out the forms, picking them up that evening or the next morning to try and hit as many of these communities, maybe those that aren't able to get in a car and go somewhere. So as far as we're looking ahead to get a lot of people through in these drive-throughs, we also know we have to pinpoint neighborhoods where there's vulnerable communities where people have not been tested as much as others, that we have to see where the risk is. So as I mentioned last week, a layered approach. We're going to, again, it's not a one-size-fits-all strategy that we have. Great coordination with our hospital partners and our nonprofits across the state. And we look forward to just seeing this number go up. We know people have been waiting for the test. We now are just, hoping they sign up and they come. So good news on this front, sir.
Yeah, really good news, and really an exceptional effort there in Seaford with the dry run on our new testing protocol. They're very excited to be able to move 600 tests in a couple hours and get people trained up. Obviously, our ability to test in the order of 80,000 a month, as we get this fully up and operational, and is going to be critical to our ability to manage the risk associated with the spread and to isolate folks that are testing positive. And part of that, and I'd just like you to comment again briefly on our partners, will depend on our partners from the beginning. Over a vast majority of the tests that we've been doing to date has been done by the hospitals across the state, over 30,000. They've made a commitment, I think, to continue to do that. Why don't you talk about the various partners, maybe the idea, as you mentioned, that we're moving into more community testing than testing at hospital locations, but what's that going to look like, AJ?
So, no, I think you make a good point, where the state's one part of this solution. The 10,000 people we talked about down in Sussex County in the community and the poultry industries were 95% lift from the hospital partners, so we can't do it without them. We have commitments from the hospital to really maintain that source for the next several months, where they are getting, we're getting Nemours, St. Francis, Christiana up north on the phone once a week, looking at our schedule 7 to 10 days out to make sure we have a strategy for where we're going to go, making sure one of them doesn't go to one side of the street Monday and then somebody else is going to the next other side of the street Tuesday. So the strategy is there, the partnership's there. We know we bought 200,000 tests because we know there's issues with the supply chain. So, we have to anticipate how far that's going to get us. We know there's other type of tests out there that our hospitals are getting, that public health has access to, et cetera. We're looking to bring some pharmacies on board, which Dr. Tate could talk about. We'll be doing a first responder only night down in Dover Wednesday as well, to get the law enforcement and public safety individuals, that need to get tested in and out quickly, knowing that they have, a high risk with their jobs as well. So again, it's identifying those neighborhoods and then finding who's the right partner to go into them to get the person to actually respond. 80,000 is going to be a lot of people to test every month, and I hope that just because somebody comes one week and gets a negative, they have to manage their risk when they leave the testing site. They'll be given instructions, the face coverings, the hygiene, all the outreach that public health has done for the last 10 weeks does not stop just because somebody has a negative test. So I think we've seen that as we enter phase one in a little bit over 2 weeks, our risk is going to be just as great as it is today, knowing that people are going to be, getting out of the house, going back to restaurants. Our responsibility, which means if somebody gets a positive test result, they have to stay home and they have to let people know that they've been in touch with. If somebody thinks they've been at risk, they need to go get tested. They need to make sure they wear their face coverings. They need to follow the hygiene. So all our partners are pushing that message out as much as possible, and it's not a one-size-fits-all. And I think we're lucky in this state to have the hospitals that are committed to work with us, still 6-8 weeks out, and they're right there with us.
And they've been doing a great job. And obviously, one of the main objectives as we move into this new phase is to protect our vulnerable populations, our senior citizens and nursing home. And that's why we've made the commitment to test all nursing home residents and to test staff on a regular basis, which was a recommendation earlier this week from the White House Task Force and the CDC. And we know that that's critically important as we allow people to circulate, and our ability to allow people to continue to circulate and continue to reopen will depend on our ability to test and to test extensively and isolate those who test positive. We've also heard from employers who wanted testing, and AJ, I know you know that, and we'll be looking to incorporate that into our protocols. I talked to the president of the University of Delaware, who's representing us on the regional task force focusing on the higher ed issues, and he wants to test all of his students and faculty, which is an important thing as they come back to school, when they come back to school, and we'll have to deal with that question down the road. But lots of really good things happening there. AJ, thanks for your leadership in that of public health. Dr. Rattay, I know we've had some challenges with our data, but we feel like we've got a handle on it. Would you like to talk a little bit about that?
Yeah, absolutely. First, I want to say, AJ, thank you so much for your partnership and leadership around testing. The testing and contact tracing are so incredibly important for our reopening efforts. And Governor, thank you so much for the measured approach to moving us forward, to keeping people safe as we reopen our state. When we think about this from a public health perspective, I think none of us want to go backwards. None of us want to have to turn backwards after we start reopening. And so I know it has been mentioned already, but I really want to emphasize the importance of a shared sense of responsibility for all of us to ensure that we are successful in reopening, which does mean we have to stay 6 feet away from each other. And I worry that message might be confused as we start to go back to what feels like a sense of normalcy. So staying 6 feet away from each other, wearing face coverings at all times, especially when out in public. We are excited to, in a measured way, reopen pools, but not the time for pool parties. And that would include even, people who own their own pools. Memorial weekend's not going to be the time to invite, 50 people over for for a pool party. So we all have to continue to behave like we all have the virus, because we need to protect others and ourselves. And again, none of us want to go backwards. So let me talk a little bit about data. As the governor's talked a lot about the different data metrics that we're looking at to help us know when we can reopen, when we can continue to move forward. This is very important for us to understand if we're seeing a surge of infections. But it also is helpful, I think, for people to understand that sometimes what you might see on the dashboard might be an incomplete picture. For us in public health, it is really important to be as transparent as we can around the data, which is why we have been very excited about putting our data on the My Healthy Community website, so that you can see simultaneous to us what we're finding in the data. So this is real-time data, which is new for us in public health. As epidemiologists, we often spend weeks, months analyzing and ensuring that our data are of the highest quality and that there's no errors in our data. We're adding what we have on a daily basis, but there are things that may create variability. The governor has used the term lumpy at times. The lumpiness of how the data comes into our system can really reflect what you see out there. We see variability in whether it's case counts or test data from day to day. And these trends are influenced by testing patterns, like who gets tested, test availability, but also how the labs get bundled when they come to us. So we had a situation this last weekend where on Sunday we had 9,000 labs come into us, which was more than quadruple the highest that we had had any previous day. And therefore, because of that high volume, what you saw for several days after that were incomplete data, specifically on where you noticed it, where many people noticed it, was on the percent of who tested positive. So what we're showing on this slide here is, if you look over on the chart on the left or the chart on the bottom, you see what was on our website on the 10th and on the 12th, which looked like we were actually seeing an increase in percent positive cases. But what it really was a reflection of was on that final day, the data were incomplete and they were biased towards the positive, as Governor Carney was mentioning. Where we get the positives into the system so we can case investigate sooner. We knew, and we looked into it very closely, that wasn't a reflection of what we were seeing in the communities. For example, in the poultry plants, we were seeing lower infections by far than we expected. But we know it's what you saw, or some people who are looking very closely at these data and saw it as worrisome. So now the rest of those cases have been calculated. And so today's percent positive chart is the one up on the upper right side. And actually, this is really quite exciting that we have been able to see significant decreases and holding about 10% positive cases, which is really a nice number. Of course, we are looking forward to when that's 0%. But this is a good number, and it really is a reflection that we are starting to see ourselves be on top of this. But as it relates to the data itself, we've looked at a number of solutions in hopes that this isn't what you see again in the future. We have trained a number of additional people. We have looked at technological solutions, and also in the future, if we do run into this situation, we will suppress the days where we have less than 100 cases in the system, so it doesn't get skewed like this. But we just wanted to acknowledge that we understand that this was an issue and a concern for people who were looking closely at the data. And again, just sometimes a reflection of what happens with real-time data. So thank you very much. I'll hand it back to Governor Carney.
Thank you very much. As I said at the outset, Dr. Rattay and AJ have been doing just an unbelievable job, and their teams, and we really appreciate what they're doing. So many things to do, and there are not enough hours in the day to do all of that. We really do appreciate it. As I said at the outset, our effort is one to strike the right balance between reopening the economy, sectors of the economy in a safe way for workers, for customers, and for the public, and so that we can keep our economy strong and protect public health. We're making these decisions, not just one person here. We consult with our public health experts. We have Zoom town hall meetings with small business owners and customers and workers, and we just try to strike that right balance so that we can move back, turn the lights on gradually, like a dimmer switch, as I like to say. We're using the dashboard of criteria to trigger these reopenings that we've displayed in each of these press conferences, and we're moving to an important new phase. And it's a phase where we'll be gradually allowing people to go back in more public circulation. We would still ask them to wear masks and to be careful. The virus is still there, hasn't gone away. It's still a threat to public health, to your health individually. We're going to lean into protecting our senior citizens and residents of nursing homes, in particular, to watch our hospitalization rates, to make sure that the hospitals can care for folks that may get sick. They are eager to get back to doing elective outpatient surgeries, and we'd like them to do that so that they can get revenue, and so Delawareans can get the surgeries that they need to stay healthy and to live a more comfortable and happier life. We've tried to do interim steps. It's not a light switch, phase 1, phase 2, phase 3. We've tried to accommodate the needs of individual business owners and sectors as long as we could accomplish that, or they could accomplish that in a safe and sound way from a public health perspective. And so it's a bit of a mixed message. Now's not the time to go wild and run to the beach and get out there with lots of friends and have a party on the beach with 20 or 30 people. In fact, that would not be permitted. You would be allowed to go on the beach, given limitations of each of the beach communities in terms of so that they can manage. We will keep in place, at least for the short term, the short-term rental ban, as well as the out-of-state quarantine, to try to limit the access to the beaches for Delawareans, only to help the towns address and keep social distancing on those beaches. And so with that, I'll open. We've had a lot of questions that have been sent in advance, and I would open it up to those questions now.
This question's from the Delaware Public Media. They ask, will the state be doing any enforcement or spot checking of community pools to make sure they're complying with the guidance you've given them for opening?
So we rely pretty heavily on voluntary compliance in all the restrictions that we've been making we've made over the last 10 weeks. We have had targeted efforts, enforcement efforts, mostly to remind out-of-state travelers to pick one, that there's a 14-day quarantine. We will have additional state police presence on the roads to the beaches from other states to remind people of the 14-day quarantine. With respect to swimming pools, we will have staff available for consultation, and most of that enforcement will be driven by complaints that we will receive and follow up on, and mostly try to initially educate owners, business owners, and pool management about the criteria, the objectives of the criteria, and how they can accomplish it.
As a follow-up, they asked, for example, many pools rely on high school and college students to serve as lifeguards to enforce pool rules. Is that a system that can be relied upon in this type of situation?
Actually, my experience with high school and college lifeguards is they're pretty tough. I know in the beaches across the bay in New Jersey, they have beach tag systems, and most of those beach tag enforcement officers, if you will, are young college, and I don't know if they have high school students, but certainly young college students, and they get compliance. If somebody doesn't have a beach tag, they're able to move them off the beach. If people get obnoxious with them, they have local police and senior lifeguard managers that can come over and help out. But the same thing is true at pools with respect to the lifeguards. I think the effort is ultimately initially to educate, to inform and educate, and if somebody continues to resist, to talk to managers, pool managers who tend to be adults, and in the very rare case that some law enforcement agency might need to be called.
From Sean Green at WDEL, Governor Murphy mentioned in his shore opening announcement on Thursday that he was in close conversation with you and Governor Lamont of Connecticut. What went into those discussions, and how comfortable were you in the decision to open?
Yeah, Governor Murphy and I have talked frequently about a lot of challenges that we face. Obviously, when New Jersey was experiencing such a really difficult problem with hospital capacity and ventilators, we were in touch with him because we did have access to 100 ventilators that came to us from California, and we made them available to him knowing that we would never be able to use them. They were never delivered there because they were redirected to Michigan. But so we've talked on a regular basis. Mostly it was about what to do at the state level versus what to allow the local beaches, towns to put in place there. New Jersey has a very different system than we do with the beach tags that I mentioned earlier. And ultimately, we had talked about maybe doing a joint announcement and decided to do it separately. When you go to the beach in Delaware, you're used to referring to them as the Delaware beaches. In New Jersey, you go to the Jersey Shore, and they are part of Delaware and New Jersey's identity. We have different characteristics there in each, and we've taken a little bit different approach, but by and large consistent with the objectives of keeping people safe on the beach, limiting the number of people to the beaches, allowing for a lot of local control and enforcement, and those things have been pretty consistent. And I think there was an objective not to get too far ahead of ourselves, but to be conscious of the summer months coming, and to enable families to get back outside in a safe way and enjoy the beautiful beaches that we have in each of our states.
From Doug Rainey at Delaware Business Now, with Ocean City opening hotels to all comers, should Delaware allow hotels in coastal areas to have done the same, or allowed in-state travelers to have a lodging option? Also, did the coronavirus outbreak in Sussex County play into the decision to keep hotels closed to non-essential travelers over Memorial Day?
Yeah, the answer to the last question is not really that much. As it turned out, the outbreak among poultry worker communities in Sussex County was something that we kept an eye on. But as we saw the fact that the hospitalization numbers weren't going up, particularly in Sussex County, they were actually going down. It gave us a little bit of comfort level that we can, again, move gradually. The reason for the continued prohibition on short-term rentals and the out-of-state 14-day quarantine was really to try to use those as tools to limit the number of people going to the beach communities during this gradual reopening. Now, it's hard to say that, opening or lifting some restrictions on the beaches over Memorial Day can be gradual, but the objective was to just try to keep it for Delawareans without violating, constitutional rights to travel among states. Initially, both of those were intended to limit the visitors that we had coming to the beaches in Sussex County early on, and to limit the border crossings that we were getting in northern Newcastle County, because liquor stores were open here and not the state stores over in Pennsylvania. Now it's being used this early on in this interim step as a phased approach to try to control access to the beaches. And we will evaluate it. There's quite a bit of pressure coming, as you might imagine, from the towns and that business sector about eliminating the short-term rental issue. But it is intended for this to be a tool to limit access, to limit the onslaught of people to those beaches, so that we can have increased access on the beaches or increased activity in a safe way.
From Melissa Steele at the Cape Gazette. In your May 14th press release, you opened community pools on May 22nd, but specifically noted swim teams would not be allowed to practice. Why wouldn't swim teams be allowed to practice, and social distancing is doable when doing laps? Also, is there a timeline for when young people can restart their sports, since there are many healthy, active kids who are starting to go stir crazy?
Well, first of all, we are eager to try to provide opportunities for our young people to be active and do it in a safe way. We also know that our young people are often difficult to control from getting really closely with one another, their friends and the like. I was never much of a swimmer. My sisters were and participated, my 5 sisters, on the swim team there. And so I'm not as familiar with the interactions, but I know that Dr. Rattay and others on our team know a little bit more about it. And apparently there's a lot more physical interaction that we were trying to be careful about allowing early on. Dr. Rattay, would you like to?
Yeah, when those begin to, when people, begin to look into the reopening document, you'll see that there are opportunities now for kids to begin to get back into physical activity. The social distancing piece is going to be what is really, really important, as well as the hygiene as kids become more active again. For those of us who've been involved in swim teams, it can be difficult to social distance when you have many individuals who are close together. But there are measured approaches laid out in the reopening document that is going to allow, whether it's swimmers on swim teams or other athletes, to begin to resume their activities.
And so again, just to underscore the approach, which is a gradual reopening, learn as we go, test what's working and what doesn't. I think back to the early days of the shutdown, when we were allowing some of the big box stores to stay open because they sold food, and the supermarkets, and it was somewhat chaotic, I think. And then we came down and communicated with them, educated them about ways to do things more safely. And now we see one-way aisles in supermarkets. We see demarcations on the floors of the building. We limited the access to the building to a percentage of the fire code allowance, and required that 6-foot separations be marked on the street outside of the building. Somebody be there to keep account, and I see that now as I go out to the Acme or to Home Depot or whatever it is.
From Amy Cherry at WDEL, does the state or NORC have any plans to roll out an app in connection with its contact tracing program? And if so, will it be required or voluntary? How will contact tracers handle those who refuse to answer their questions?
Yeah, so a couple things there. One is I'm really excited about the fact that we're making progress on contact tracing, and I know Dr. Rattay is, and I'll ask her to comment on it as well. I think we've got a really good partner in Newark in terms of their level of expertise coming out of the University of Chicago, their partnership with the state of Maryland. I really like the idea that we're phasing it in using the Army and Air National Guard and access to their bilingual Guards members, those who speak Spanish, and that's a really good thing already. I think we've got 30-some doing that kind of contacting, and so really excited about that. There's been some discussion, I know, and conversation around using technology like that. It's somewhat controversial. There was something I heard this week about states in the upper Midwest, North Dakota, South Dakota, using that, and some decided to use it, others backed away. I think it's technology that could be useful, but that I think you have to be careful about with respect to individual privacy. Dr. Rattay?
Yeah, I would agree completely. I mean, we're very excited about the contact tracing program, and it is not a Big Brother's here to watch you kind of program. It's and we I think maybe some of the fear that people may be thinking about, maybe from other countries where there's a really close eye on what people are doing and what their behaviors are. What this really is about is identifying those people who have been exposed and are at risk of developing the infection, and giving them the support they need to safely quarantine. And for many people, that is support they need. They may need groceries. They may need a safe place. They may need somebody to reach out to their employer to say, you need to allow this person to quarantine for 2 weeks. So it's not a, we're watching you kind of program, and we're not going to be using an app to follow people's movements. It's really about helping decrease the spread of infection by supporting people who've been exposed.
And I think it's important to point out, I just want to underscore this point, because I know we've gotten questions from a number of members of the General Assembly around this technology and the whole idea of contact tracing. It's a trade-off. Right now, we're accomplishing the goal of limiting the spread by widespread shutdowns, stay-at-home orders, the blunt instrument of those mechanisms, which people are saying they don't like. The virus isn't going away. We've flattened the curve. We've reduced the spread. Delawareans are credited to that, and we see it in all the data. But now we're going to reopen things. The trade-off is, in order to have that, bring that economy back and have a strong economy again, have people go to work, earn wages, and all the rest of that, you have to have another way to manage the public health side of it, to manage the spread of the virus. And that's by intensely testing, which AJ is going to head up, and by doing the contact tracing and isolating. Instead of isolating the whole community with the stay at home and the shutdowns, we're trying to isolate the individuals who are COVID-19 positive. That's the trade-off. It's not an option to say, okay, everybody's on their own now. That's not an option.
As a follow-up, Rick Jensen from WDEL asks, exactly how much will the program cost in both the purchasing and/or leasing of the program itself, and projected weekly or monthly expenditures for the people you intend to hire to do the tracing?
Yeah, so we're still in the process of putting the budgets together for both the testing program and for the contact tracing program. It will cost multiple millions of dollars. Just to give some general sense, the 200,000 tests that we just purchased were $30 million. And so it's not inexpensive. A lot of the CARES Act funding that we receive from the federal government will be used for both of these programs. We're going to be hiring close to 200, I think, contact tracers is the number. We'll need them to be employed for at least a year or longer, depending on the development around a vaccine and other factors associated with this invisible enemy. And so our hope is that we'll be able to cover the costs with the federal funding, with funding that the county executive has received as well here in Newcastle County and in the towns in Newcastle County, and we're still working on that budget. But just the order of magnitude is that just this one set of tests, 200,000 was $30 million.
And this will be the final question from Jacob Owens at Delaware Business Times. With more than a half dozen states choosing to piecemeal its recovery by county, why has Delaware chosen to pursue a statewide reopening, especially considering the situation in Sussex County continues to be worse than in Kent and Newcastle counties?
Yeah, so obviously, from my perspective, it was always, I think, better to do things on a statewide basis. If we were to do anything by county, I think what we would end up with would be with more restrictions in Sussex County than in Kent County and Newcastle County. In some cases, that could make things worse with respect to, and it's easy to travel from one end of the state to the other. It's only a little over 100 miles, 2 hours if you're going to the speed limit, 2 hours plus. And so we've been more concerned about consistency with respect to states in the region, and we talked about that today with respect to access to the beaches in Maryland and New Jersey, Virginia to a lesser extent. Obviously, some of the restrictions over the line in Pennsylvania have been problematic for us, but it was always, I think, the intention to do things that way. The political environment in northern Delaware is different a little bit than in Delaware, and we're seeing some of that with respect to adherence to some of the restrictions. And what I try to do is to communicate to every Delawarean that the hottest spots in our state right now are in Sussex County and concentrated in workers in our poultry plants. The extensive testing that we've done in an unprecedented way, really, when you get right down to it, in the plants and in the communities, have identified more positive cases, but I think fewer than we expected. Hopefully that we still have lots of those tests to complete and to process, as we've talked about through the press conference today, and hopefully those trends continue. And that's why, with all, I don't think I would do anything different with respect to restrictions in northern Newcastle County or in the northern part of our state than in the southern part of our state if we didn't have a situation like we do in Sussex County. The criteria, the dashboard of criteria that we use applies across the state and is consistent with the guidance that we've received from the federal government and the CDC, the White House Task Force. It's consistent with principles that public health officials here in Delaware have recommended, and it also tries to strike the right balance between economic recovery, people's willingness to follow the rules and the restrictions, and the imperative and the needs of public health and the economy. So with that, I want to thank everybody for tuning in. I want to remind everybody again that we're in this together. The stay-at-home order is still something that we want folks to follow. We need your cooperation. We're allowing more businesses to open on a limited basis. We're still emphasizing social distancing, appropriate hygiene. And now's not the time to go wild and run to the beach and not be careful. Now's the time to be careful and to make all the terrible costs of the last 10 weeks worth it. So thank you very much, and we look forward to seeing you next week.